Do you think of anticoagulation as a dying career for pharmacists? Well, honestly, that's what I kind of thought. That was one of the things that I did as an ambulatory care pharmacist, and I wondered, why is this still going on? Are you worried about being an anticoag pharmacist, knowing that the demand for this seems to be disappearing? And in this video, we're going to be talking about anticoag and the surprising amount of jobs that maybe you didn't even know existed in anticoagulation. Hi there, I'm Alex. I'm the founder of the Happy PharmD, a career coach company that helps pharmacists get careers and jobs that they love. And in this video, we'll be diving into anticoagulation, the salary, the satisfaction, the job market demand, and the flexibility of being an anticoag pharmacist. And so with that, let's jump into things. So what does an anticoagulation pharmacist do? Well, they typically deal with all things anticoag. We're talking venous thrombosis, strokes, some other things. A lot of the work is fairly repetitive. It definitely involves clinical decision making. It definitely involves formulary management and formulary choices. But it's a niche that started off kind of big for clinical pharmacy and then died out over time. Ever since the DOACs, or the direct oral anticoagulants, came to market, we're talking dabigatran, rivaroxaban, the demand for warfarin management has significantly decreased. These pharmacists practice in all sorts of settings, but typically within ambulatory care, health systems, settings where they're able to meet with patients, educate, and they usually have other roles. There aren't a whole lot of pharmacists specifically just within anticoagulation anymore. We don't have any specific data that report how many pharmacists are practicing in this setting, but we do know that according to one certificate program in 2017, there were 361 pharmacists who had completed their anticoag certificate. There isn't a board certification specific to anticoag, but many pharmacists do get things like BCPS or certified in ambulatory care. There isn't a anticoag specific residency program, but a kind of a newer field has emerged in recent years. And there are 6 PGY2 programs in hemostasis management, which I think is kind of interesting. It's very niche, and I wouldn't say hugely in demand with that few of a residency program. A typical job title for this role would be anticoag pharmacist. Sometimes you'll see clinical pharmacist and then / thrombosis and hematosis management, but that typically is it's a subtitle. Let's talk about the salary of anticoag pharmacist. How much can you make? I'd love for you to guess. What do you think? Put your comment below to see how close you are. Ready, set. The average, according to ZipRecruiter, was $120K. Lower. Such a bummer. It's a clinical pharmacist role, and yet you can get paid more in retail or in a hospital job, typically starting off with an average salary. That's a common theme in these clinical pharmacy jobs, is that you don't get paid as much as others. The highest paying roles for pharmacists in this field were in Santa Clara, Washington, and Washington, D.C., interestingly enough. Of course, everything is more expensive in these places, so you should expect to get more. One sample job we looked at in Las Vegas, Nevada, reported $113 to $135K. Kind of a wide range there that I'm sure you could negotiate for a going up higher, which is nice. Another job on ZipRecruiter we found was $121 to $145. So for salary, I'm going to give it a score of 6 out of 10 because once again, it's another clinical pharmacist role that should mandate the doctorate of having a pharmacy degree, and yet you still are not paid more than the average retail or hospital pharmacist. That's such a bummer. You're getting paid to do a top of your license kind of stuff, and yet you're not being compensated for that added responsibility, risk, although it's very low. That's such a bummer to me, and that's why I rated it so poorly. But on the flip side, still, it's 6 figures. It's nice. Let's not kid ourselves. Making 6 figures right out of college was pretty good. By the way, if you haven't already, I would encourage you to subscribe if you like this kind of content, because it's what we talk about all the time, getting into career topics in pharmacy and helping pharmacists love what they do. Let's talk job satisfaction. Look, I think satisfaction is like, it's the thing that should drive you. It's the why behind why you do what you do. And for me, honestly, I didn't enjoy it, but I know many people do. While there isn't any specific data around anticoagulation, we do know that clinical pharmacists have a high burnout rate, around 60%. Now, it varies from profession to profession. We know that in general, pharmacists are burning around at ranges anywhere from 50 to 70%. That's pharmacist wide. So there's 330,000 of us. Basically, half of the profession is burned out. We know that clinical pharmacists have a higher risk of it as well. And I have to say, though, from my experience, and also just helping pharmacists get into anticoag, like, it's not that much of a stressful job. You're using high clinical knowledge, you're definitely interacting with patients, but at the end of the day, it isn't usually very demanding of a role. It can be more demanding in some of these hematosis and thrombosis management positions because you're typically, dealing with inpatient setting emergency situations where people are, they just had like a clot appear and you got to take care of them in those settings. But the management where most of these jobs are, right? It's ambulatory care, it's primary care, where like the setting is not that crazy. It's not high pressure. You typically have time to educate patients, to call them. Often it's remote work. So like, I think the pressure is pretty nice. And Reddit anticoag pharmacists confirm it. A few quotes from people that we found saying, quote, "AC clinic is not hard. It's extremely repetitive." And I can totally agree with that. Holy cow, did I find it boring. Again, like, I don't want to make it sound like you wouldn't enjoy it. It's right for the right person. But if you feel like you want to be more creative, like this isn't the path for you. And I know that I'm not the norm. I'm a weirdo. I'm a pharmacist talking about careers on YouTube. Okay, like that is super weird. So I got to acknowledge that. Don't listen to me. Other pharmacists on Reddit said great low pressure job, generally low stress. For these reasons, I'm going to give it a C, 7 out of 10. Like, it's a fairly low stress job, really repetitive. You get paid well. It's not going to be insanely fulfilling, I think, for a lot of people, but at the same token, like, it's a decent job. You're paid 6 figures. You could be probably pretty happy doing it. Like, you're going to interact with patients. It's pretty good. I would say it's pretty good. But let's talk now about job demand. Are there tons of jobs available? Well, you may be actually surprised, as I was. I was expecting, honestly, dozens of jobs, not over 100. On Indeed, we found 200 jobs available, and 71% of them were entry-level positions. On ZipRecruiter, we found over 130 jobs for pharmacists that were getting paid over $120,000 a year starting. I love that. But please note that many of these jobs put in the words ambulatory care. That could mean a residency is demanded for these kinds of positions, but it's not a 100% guarantee. We found lots of ambulatory care jobs that don't require any residency. But I think it's important to note that the main workhorse of anticoag was warfarin. It was like one of the first things that clinical pharmacists got to take over from doctors. It was well documented, many times now over the years, so many trials out there proving that pharmacists do a better job of warfarin management than a physician. Great. But once the DOACs came along, everyone thought this is way too much work for this much benefit. And so, when I was in ambulatory care, we had a lot of patients being switched over to the DOACs. And for management for that, it was like monitoring them every 3 to 6 months to see how their liver enzymes and kidneys were doing. And like, it just wasn't a whole lot of work for us. This leads me to conclude that like anticoag is changing. It's becoming much more narrow and niche. The demand for warfarin management it's dying out because of innovation, which is good. But on the flip side of that, you've got a situation where there's like a new subspecialty happening. Hemostasis and thrombosis management roles appear to be popping up, which is cool. It's good, but it's not a hugely in-demand role right now, and I don't see it significantly growing. We're talking like dozens of jobs in this field, not hundreds. One factor we look at is bonuses, and we found a few of them in specific jobs. We found one job with $10,000 sign-on bonus. That's pretty nice. Look, to be an anticoag, you can get training, guys. You don't need a residency for anticoagulation training, in my opinion. Of course, it's great if you have it. Like, I'm not trying to poo-poo residency here, but I'm saying that you definitely don't need it. Once you get the basics, you get some training on the job, you'll be fine. It's not hard. Let's give demand a score now. I'm gonna give it a 5 out of 10 because this, to me, feels like it's not a dying niche of pharmacy, but it is certainly a shrinking in demand role. I don't see a lot of these roles happening. If you go into this field, I think you need to be very, not concerned, but just like be very aware that you could be laid off eventually. If not laid off, like absorbed into the clinical pharmacy staff, which in the end isn't all that bad. All right, let's talk about the magic factor, flexibility. Is it easy to get into, get out of? Is remote possible? Well, first let's talk about schedule. Work hours for these roles is typically Monday through Friday, 8 to 5. It's very nice. Holidays off, weekends off. Sometimes there is an on-call component, but even those pharmacists who are on call, we've heard that they're not usually like needed, which is nice. These thrombosis and hemostasis roles, we have seen a little bit more of a demanding nature. You're often in the hospital clinic, which of course is, more stress, more pressure because of the nature of patient care. And so on-call is usually more involved with these roles. We have often found that they are remote positions are happening more and more. We found a few jobs that showed that, 8 to 5 p.m. shift. It's very nice. Hybrid, remote are often available. We found a few roles that reported being remote, which is nice. Out of 7 jobs that I looked at on LinkedIn, none of them required residency or certifications. Very nice. I take it to mean it's easy to get into, so don't let that stop you. And most of these positions barely had any applicants. We're 1 applicant, 0 applicants. Goodness gracious. But the one downside to flexibility is getting in and out of it. One thing that happens to clinical pharmacists is once they get into a certain niche, they feel sometimes that because they get rusty, it prevents them from getting into other fields of pharmacy. I remember one PGY2 ambulatory care pharmacist feeling like an imposter trying to get a part-time job in the emergency department and not feeling good enough for it. We have this epidemic in pharmacy of imposter syndrome where we just don't feel good enough to do certain roles. But at the end of the day, what this comes down to is self-confidence. Being an anti-coag pharmacist doesn't mean your career is going to die because you're not going to be able to do something else. You can go do anything. Go into community, go into home infusion, go into clinical pharmacy, go be in research or pharma. Nothing is stopping you other than yourself, really, and just consistently in trying something different. And if you're looking for a different approach to career exploration and job searching, I would love you to check it out in our community. We have lovely pharmacists in there who are networking, supporting one another, giving feedback, and helping each other create careers that they love. Every Thursday, we do workshops on different career activities, and I would love to see you in it. There's a link to join our community, which is completely free, somewhere below in the description. For these reasons, I'm going to give the flexibility factor here a healthy 8 out of 10, because Monday through Friday, sometimes remote, it's really awesome. And I guess you could argue that, once you get down this path, maybe you get rusty at your other skills, but you're smart, you're a pharmacist, you can figure it out. You can go do something else. And now it's time for the final score for anticoagulation. Well, first we start off with salary, which we gave a 6 out of 10 because it's getting paid less than the average pharmacist salary, but who knows, maybe it's because of a lack of stress that's there. That's why it's lower. I don't know. For satisfaction, we gave it a 7 out of 10. While I think, and some others think it's kind of boring and repetitive, it's fairly simple. You're dealing with patients, you're enjoying patient interaction, and it can be a lot of fun. For demand, we said 5 out of 10 because the market is definitely shrinking and there's not a ton of jobs, but there's also not a lot of competition there. And for flexibility, we gave it an 8 out of 10 because of the great schedule, giving Anticoag a final score of a 6.5. What did you think of my scoring? If you're an Anticoag, was I too harsh? Did I simplify too much? Let us know your story and your opinions in the comments below. And let me ask you, did you like this video? Let us know by liking it or hitting that dislike button and letting us know what we can do differently to make our next video better. Thanks for watching this video, and until I see you in the next one, take care.